My name is Ade Abner, and I'm 44 years old, and I'm a dialysis patient. I've been on dialysis since 1999, and I'm a registered nurse by profession, and I'm active. I'm working and paying my taxes, and I would just appreciate it, whoever is listening, to come out to help. We are about 30 something left that we don't have any place to go for our dialysis treatment after Grady shut down the dialysis clinic. And by next 2 months, which will be in August 31st of this year, 2010, we'll be out in the street without no dialysis treatment. And without no treatment, this is death. In a couple of days, all these 30 people will die. And whoever is listening, we're hoping that you will come to our help and assist us in whatever way you can. And thank you very much.
I'm Neil Shulman. I'm a doctor. I was trained in nephrology, kidney dialysis, and have had the good fortune of having a book I wrote called Doc Hollywood made into a movie, and this has given me some resources to be able to help or try to help people who need advocating for them relating to their health care in America and throughout the world. And I had the opportunity to put a conference together with many wonderful people on medical volunteerism, which I think is an extremely important component of our world. And we have a website, www.emoryimvc.org. I am not, in this interview, representing any institutions whatsoever. I'm only giving my personal opinion relating to a very serious issue, and that is one dealing with people who need to have dialysis care, have been getting dialysis care, and may lose the support for their dialysis, so therefore it could be a life-threatening experience, and we want to do all we can to help those people stay alive and to improve the access to patients who need this very important life-saving therapy in the United States. As I understand it, you received a few days ago a letter from Grady Hospital saying that this letter is a reminder that Grady will no longer provide support for your outpatient dialysis care after the contract with Fresenius expires on August 31st, 2010.
That's correct.
Is this correct?
That's correct.
Now, just to give an overview of what has happened, my understanding is that you are a nurse.
That's correct. I'm a registered nurse.
You're a registered nurse,
Yes.
and you work as a nurse in Georgia.
Yes, I've been a registered nurse since 1990 back home in Nigeria, but I became a registered nurse here in 2006 after taking the nursing board exam. So I've been working as a registered nurse since 2006.
Okay. And you also have a green card.
Yes, I have a green card.
And you also are married to an American.
Yes, I'm married to a wonderful man who is from Savannah, Georgia, here in the United States.
And in addition to all these things, you pay taxes?
Yes, I've been paying taxes even before I started working as an RN. That will be, I've been paying taxes for over 10 years now.
For
8
over
to
10.
10 years.
8 to 10 years. Okay. And you're a little scared.
It's more than being scared because this is like a death penalty, like you're in a death row because if the treatment, which is the dialysis, is stopped, and in a couple of days, so many things is going to be wrong in your body, and you can die within a week of not having a dialysis treatment. So it's more than being scared.
And your husband is concerned as well.
Of course, he's very concerned because he doesn't want to lose me, and I don't want to die either. So I'm very young, and I don't want to die. I just want to stay alive, and that's the only way I can be alive is to get my treatment 3 times a week, like I've been doing for the past 12 years now. About 12 years since I started dialysis.
And how old are you?
I'll be 44 in September.
44 years old.
Yes.
And by the way, I should say that I'm speaking to you as a doctor, but I'm not representing any organization at all. I'm just talking as an individual because I do feel as though your story is important for people to hear. Now, dialysis care is required when your kidneys go bad in order for you to stay alive, and then you can function very well. But if you don't get regular dialysis, then the poisons can build up in your blood.
That's correct. What actually happens is when you have kidney failure, the kidney is shut down. As a matter of fact, I have a chronic renal disease, which means my both kidneys are completely down. None of it is working. And what the kidney does is, to help remove the waste product from the blood and filter it through the kidney, and you pass it out either through urine or by sweating or having bowel movement. But for about 6-7 years now, I don't make urine. The only way to get the waste product off my body is through dialysis. So if I don't get the treatment, it means that all the poisons, the toxic, the waste product, they all build up in my body, and before a couple of days, it affects all the organs, my heart. I can stop breathing. Anything can happen. Anything will go wrong if the poison is not removed from my body by dialysis. So it's very vital that I get the treatment. And that's what has been sustaining me for the past 10-12 years now.
And you go to church every Sunday?
I don't miss church because I'm a child of God, and I believe so much in God because He's done a lot for me. Coming over here, I don't have anybody here. I don't know anybody here, and I became sick. And He's always, put me through, the direction, the way to go. So I believe so much in God, and I believe He's been helping me, because I can't do it by myself. I need God's intervention. I need God to move. And the only way He can do it is using people, touching people's heart so they will have compassion, so that, this is very important. I don't want this person to die. And that's God that can do that. And I believe He's already doing it because I don't even believe Grady can, still be paying for our treatment because, to be honest, Grady has really tried for a lot of people. He tried for me. He's been, taking care of me for 10 years. So they really did a tremendous work. Just that I don't know why they want to stop now.